Welcome back to my channel. Today, we're going to talk about a topic that's on everyone's minds: the COVID-19 XEC variant. Now, let's be clear. The XEC variant is not a new strain of COVID-19. It's actually a combination of two existing variants derived from Omicron subvariants. The XEC variant is currently the most prevalent variant in the United States, accounting for about 40% of all cases. It's important to note that while this variant is more contagious than the original strain, it doesn't seem to cause more severe illness. The Centers for Disease Control and Prevention is diligently monitoring the emergence and spread of variants of SARS-CoV-2, the virus responsible for COVID-19. As variants continue to evolve, this tracking is crucial to inform public health strategies, guide vaccination efforts, and ultimately reduce the impact of the pandemic. One of the key tools utilized for this purpose is the COVID Data Tracker, which provides updated estimates on the circulating variants both nationally and regionally. The new XEC subvariant is a hybrid of 2JN1 variants derived from Omicron subvariants and represents about 14% to 22% of circulating viruses. This variant is rapidly increasing in prevalence, particularly entering the winter months when COVID-19 infections typically peak. It is important to know how new variants emerge. One of the primary ways new variants arise is through what is called antigenic drift, in which case, gradual mutations lead to the emergence of viruses that may evade the immune system. The recently discovered XEC variant has been partially shaped by recombination, occurring when two variants exchange genetic material. This results in a strain that may appear novel to the immune system and has the potential to bypass some existing immunities. Let's look at how the XEC variant arose. This variant first appeared in Germany in June 2024 and has since spread rapidly across Europe and then into the United States, where experts predict it could become the dominant SARS-CoV-2 strain just as winter arrives. As of late November, the XEC variant was responsible for approximately 38% of COVID infections in the United States, rising from 7th place in prevalence at the end of September. Here are the several key features of the XEC variant. 1. Differentiation from other variants. XEC is a recombinant strain, formed from the combination of two pre-existing COVID subvariants. This merger can occur when an individual is concurrently infected with multiple strains, unlike the gradual mutations seen in prior variants. This recombination can create a big jump in variants, although significant changes to the virus's behavior remain unlikely for now. The XEC variant also contains at least one new mutation in its spike protein, but it's uncertain how this might affect the likelihood of infection or severity of disease. Secondly, let's consider the symptoms and disease severity of the XEC variant. So far, there is no evidence to suggest that XEC causes different symptoms or more severe illness than previous strains. Symptoms still include cough, congestion, runny nose, diarrhea, fever, chills, shortness of breath, and the loss of taste or smell. While some symptoms could initially be mild, they may become more severe as the disease progresses. Let's consider vaccine effectiveness against the XEC variant. The updated COVID-19 vaccines for the 2024 and 2025 season are generally expected to be effective against the XEC and other rising variants. Although it's challenging to achieve a perfect match between vaccines and constantly mutating viruses, the new Pfizer and Moderna mRNA vaccines have been designed to target these variants. These vaccines should also offer protection against the XEC variant, since it is derived from Omicron subvariants. What are the prevention tips and vaccination recommendations for the emerging XEC variant of COVID-19? To help prevent infection with this variant, the CDC and medical experts recommend getting vaccinated. Individuals aged 6 months and older should receive the updated COVID-19 vaccine to enhance their protection against these emerging variants like XEC. The updated vaccines have been available since August of 2024. And getting vaccinated is especially important as winter approaches. when COVID-19 cases tend to rise due to increased indoor gatherings. Also, make sure to practice preventative measures beyond vaccination. Individuals are encouraged to take standard precautions to minimize the risk of COVID-19 infection. This includes avoiding close contact with sick individuals, wearing masks in crowded indoor settings, and adhering to the recommendations provided by the CDC. What should you do if you test positive? If someone does test positive for COVID-19, antivirals such as Paxlovid are available by prescription. This medication is recommended for anyone aged 12 and older, especially those at higher risk of severe illness. It is most effective when taken within the first few days of developing symptoms. The ongoing monitoring of emerging variants by the CDC. The CDC remains committed to tracking the emergence of variants like the XEC variant, monitoring their public health implications, and evaluating the effectiveness of vaccines and treatments against these variants. SARS-CoV-2 viruses are in a constant state of flux, with new variants displacing previous strains. This cycle necessitates ongoing vigilance and updates to our understanding of COVID-19. As we look forward, the landscape of COVID-19 will likely continue to shift, and we need all the preparations in place. Finally, the emergence of the XEC variant and the ongoing evolution of SARS-CoV-2 highlight the need for continued public health efforts, vigilance, and personal preventive measures. The updated vaccines for the 2024 and 2025 season are a vital tool in our ongoing battle against COVID-19 and its variants. Getting vaccinated, adhering to safety measures, and staying informed about the latest developments regarding COVID-19 variants will be crucial as we move into the winter months. By working together and taking proactive steps, we can better protect ourselves and our communities against the ongoing threat posed by the virus and its continuously evolving variants. So, let's all do our part to stay safe and healthy. Remember to wash your hands, wear a mask, and practice social distancing. And if you're feeling unwell, don't hesitate to get tested. Thank you for tuning in. And don't forget to like and subscribe to my YouTube channel for more informative and engaging content. Stay safe and take care of yourselves.